My name is Molly Fortner, and I am a family nurse practitioner student at Auburn University with a special interest in improving asthma control across the state of Alabama. The Alabama Asthma Coalition last met on September 21, 2018. Among the topics we discussed were lack of access to specialty care among rural asthma patients, lack of asthma action plan use in primary care clinics, a need for a standardized asthma action plan, and a disconnect within parents' and caregivers' participation in asthma management. I have taken these concerns, provided further description of the issues, and developed a resolution to address the issues. The purpose of this video is to present the resolution to you, the Alabama Asthma Coalition, in hopes to gain your support as primary stakeholders in moving the policy forward by contacting state legislators in Alabama. Asthma is the most common childhood disease affecting 1 out of every 10 children and is responsible for 500,000 emergency department visits and 10 million sick days each year. Asthma control is dependent upon self-management. Patients must recognize and respond appropriately to worsening signs and symptoms. Asthma action plans are the evidence-based tool available to guide self-management. They are individualized to each patient and is the most reliable way to ensure a patient understands how, when, and why to use each medication and when to access advanced medical care. Asthma action plans have been recommended in national guidelines for many years and are consistently underused by healthcare providers. Only 50% of children with asthma receive an asthma action plan. Multiple versions of asthma action plans are available for free on the internet. However, it would be helpful for a standardized asthma action plan to be developed to promote further standardized care. Parents are an essential player in management of childhood asthma. 50% of parents report never receiving an asthma action plan. Providing an asthma action plan promotes and engages parents to participate in the management of their child's asthma, where neglecting creates a gap in the patient's care. Asthma management in the rural setting is highly impacted by environmental factors. Asthma attacks or exacerbations can be triggered by allergens from seasonal crops, animal dander, air pollution, and higher rates of smoking. Asthma action plans are beneficial on a regular basis, however, are most helpful when a patient is experiencing an asthma attack. Urban children with asthma are twice as likely to see an asthma specialist over rural children. Rural settings lack access to specialty care, placing the responsibility of long-term chronic illness management in the hands of the primary health care provider. Rural areas have been known to be less likely to provide evidence-based care due to the influence of health disparities on the geographical area. Access to care, provider knowledge of asthma action plans, and compliance rates with providing asthma action plans are the primary causes of decreased disease control rates among rural asthma patients. Poorly controlled asthma leads to preventable exacerbations, causing costly emergency department visits and unscheduled office visits. Rural communities have decreased physical and financial resources when compared to urban populations and cannot afford to continue to lose money through uncontrolled disease management. Although rural providers often have similar access barriers as their patients, primary health care providers, including nurse practitioners, are responsible for providing management education through asthma action plans. The proposed resolution is that a standardized asthma action plan be required for every patient prescribed any form of asthma medication in all primary care settings. Although the rural population will benefit significantly from the policy, patients in the urban primary care setting will also receive benefit. The overarching goal of the resolution is to improve asthma control in the state of Alabama. Asthma action plans need to be brought to the attention of all healthcare organizations. Through continuing education for primary care providers and advocacy for asthma action plans to be given to all patients receiving asthma treatment, high-quality, evidence-based care can be delivered. The primary resource needed to move the policy forward is communication. Communication with the Alabama Asthma Coalition, state legislators, and primary care providers are the most valuable resource to move the policy forward. A committee needs to be established to formulate a standardized asthma action plan for statewide use. Financially, the only cost of policy change is time and education. Direct effects of uncontrolled childhood asthma cost an estimated $5 billion a year. Many grants are available for rural health initiatives and would be applied for to aid the funding of practice change, including continuing education. Statistically, the primary policy outcome would be an increase in the number of primary care patients diagnosed with asthma, significantly rural patients receiving an asthma action plan. Individual patient outcomes can be evaluated by using the asthma control test and tracking hospital admissions related to asthma, school days missed related to asthma, asthma and oral corticosteroid use for asthma exacerbations. Thank you for your time and consideration.